Greetings and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowicki, and we are here in between the adjournment of the 2017 legislative session and the veto session that's been precipitated by the governor's veto of our budget. We're going to be talking to local legislators, and today our first guest is going to be Senator Jeanette White.
Hello.
Welcome.
Thank you for having me here.
Welcome, and thanks for taking the time.
Yep.
It has been quite the interesting year in politics in general.
Yep.
We're seeing chaos every day from Washington. We've been trying to keep Vermont the stable place it's always been, but it seems like that chaos from Washington has been leaking down into the State House as well, and hence the governor's veto of a budget that basically passed unanimously except for one vote in both houses. So we can talk a little bit about that more.
One vote in the House.
That's
and
right.
no votes in the Senate.
That's right. The Senate Judiciary Committee was pretty busy this year. That's one of your two committees.
It is.
One of the things that you passed there that I think is important today and looking ahead to Vermont's future had to do with the Racial Justice Oversight Board. Can you share a little bit about what that is and how it can help Vermont moving into the future?
Sure. Well, it kind of started because of around law enforcement. That's how it started. And so in order to assure racial justice in law enforcement, we started looking at Fair and Impartial Policing and also a Justice Board, an oversight board. And as it came from the House, there were two different bills on those two different issues, but they're so closely aligned that we combined them into one bill. And so the Fair and Impartial Policing policy just says that every agency, every law enforcement agency, and I don't know if you know this or not, but in addition to the state police, there are 79 law enforcement agencies out here in the state. So they all have to have a policy. And
they're not really organized in terms of a coherent top to bottom, are they?
Well, no, and actually
That's another discussion, isn't it?
Actually, my committee is spending the entire summer looking at that issue and how we provide better coverage. But they are going to be disconnected because you have state, you have municipal, you have private or semi-private, like UVM has their own police force. You have sheriffs, you have constables, so there's a lot of different entities out there. But the current model law enforcement or fair and impartial policy has some things. It has what's called mandated and then discretionary policies that you can have in your policy as the Brattleboro Police Department. So they're looking at them because some of the ones that are listed as discretionary, and most of them have to do with immigration, may be in conflict with federal law. So they're going through that, and they'll have a final model policy, and then everybody will have to either have their own policy or adopt that one.
This Racial Justice Oversight Board,
Yep.
Now it has law enforcement, you said?
It has members of law enforcement and the Attorney General's office, and then it has, I believe it's 5 people to represent the communities of color in the state. And the qualifications for those people are that they represent the community of color and that they have had experience working toward racial justice, so that they need to have had some background in racial justice issues.
Yeah.
And I think there are 5 of the 5 people, 5 citizens, and then law enforcement. And some of the people who actually represent law enforcement might not have to be the law enforcement because it says or designee. So some of those might end up being citizens also.
Now this is a permanent board?
No, this is a 3-year, I think it's 3-year board. It sunsets, and what it does is it's looking at implicit bias and racial injustice in the law in the justice system, not just law enforcement, but the whole justice system. So the courts, the Attorney General's office, the state's attorneys, the Defender General, the whole law enforcement. So it's looking at that, and we'll be making recommendations to the Training Council about new training components that could be put into the training for law enforcement, and making suggestions about other changes in the justice system. And it'll cease to exist after, I think it's 3 years. But one of the things that is in the bill that doesn't have anything to do with that board necessarily, but it requires the Attorney General to work with the administration to set up another board that will look at implicit bias and racial injustice in other systems in the state, like housing, health, education. So that will be set up then, and that will, I don't know if that'll be a permanent board or what, but they'll come back with recommendations for setting that up.
Now, this is somewhat recognizing the changing faces of Vermont.
Yep.
And I think especially in the Burlington area, I think one of the things Curtis Reed locally has pointed out, that Windham County also has one of the largest growing populations of minorities and people of color. So Vermont is changing.
It is. And one of the other things that we worked on kind of in that vein is the issue, it's called S79, which was the immigration, so that our law enforcement people will not be enforcing federal immigration. The ACLU has since then pointed out that they were using the facial recognition system, and they've stopped using it until they determine. Our legislative council have told us that they think it's against the law, against Vermont law. So we've asked the DMV not to start using it again until we come back in January and can look at it to see if it is in violation of our state laws.
The other piece with DMV, though, that we found even with one of our neighbors in Putney is that there were DMV people calling ICE on immigrants.
Right. Well, that was the first hearings that we had before we found out about the facial recognition.
Yeah.
But
so it's certainly not something we want DMV getting involved in.
No. I mean, if there are criminal charges and
Right.
it comes up on their criminal charge list, they have to.
Yeah. I
do
think
that.
in Putney
But-
that it was an incident of somebody just going to get a driver's privilege card.
Yeah,
and then being arrested by ICE and brought to Boston and
Yeah.
eventually released. But it's not the kind of state we want to be.
It isn't, and you know, I don't know if you are aware of this or not, but when they set up the driver's privilege card, primarily what they were thinking of was undocumented dairy workers.
Farm workers.
But there are 80,000, I think it's about 80,000 Vermonters who have driver's privilege cards, not driver's licenses, including me.
Yeah.
I don't have a real ID. I have a driver's privilege card. In fact, it's still that little green one that looks like it came out of a Cracker Jack box.
Yeah. Government Operations was a busy committee as well this year for you, and that's the committee that you chair in the Senate?
Yep, I do. And I do love that committee. I know that some people think that it's kind of a dumb committee and it isn't really defined in government operations. What on earth is that anyway? But
well, ethics was a big thing to talk about this year.
It was. Well, it deals with all the structure of government, municipal issues, elections issues. And we have been talking about an ethics bill for a couple years. And this year, at the beginning of the year, last biennium, we passed one, but it was way too late for the House. It had nothing to do with the House at all. We admittedly passed it without any time for the House to reflect on it at all and do anything. So this year we started where we left off last year and passed one out on January 31st. And I think it's good. I know that there are people, including our Secretary of State, who think it should have been more robust. We looked at that, and it would have cost us somewhere around $700,000 to. with full investigative and subpoena powers and enforcement powers. And we decided that was not the route to go. We don't know what the issue, we don't know how much of an issue it is. So why start big and then have them try to justify their existence afterwards?
Part of the argument on the other side is that we're a part-time citizen legislature. Perhaps if we were full-time, then maybe something grander would be appropriate, but...
Well, but I think people are confusing what an ethics commission is. This isn't focused on legislators.
No, it's focused on all, but legislators are included in that.
Legislators are included, but the ethics issues concerning House and Senate members are dealt with by their own ethics panels. That's what our Constitution says, and that's where those ethics issues would be addressed. So, but what this does is sets up a funnel, a central point for any citizen who has an allegation or who just has a concern about somebody, who's a state employee, who's an elected or an appointed official, to call and say, this is an issue. And then that person, the ethics director, will funnel it to the appropriate place for investigation.
And in that way, legitimate concerns will be followed through,
Yep.
and frivolous accusations can be weeded out.
Right, and it also, all that will be gathered in a central point. So this won't even get going until next January, but then annually that commission will bring back information in a report to the legislature saying, you know, you had 72 concerns or allegations about this particular issue. You need to do some training on that. You need to make people understand what their obligations are. And so I think that, and what we heard from ethics professionals is that that's the way it should be. It should be about 25% enforcement and about 75% education and training. So that's where we are.
You know, the legislature receives training in appropriate behavior between ourselves and our work staff in terms of sexual harassment.
Mm-hmm.
Are you talking about education in that same vein where we would all be required to go to these workshops? And
No, I don't know that I would say, I don't know. That'll come from those recommendations will come from the Ethics Commission. It may be that we're required to. There may be, it's hard to require legislators to go to any kind of training. It's really hard because of the time. Just even scheduling something so that everybody can go is horrible. We did.
And part of that, I just want to say, is because we do try and squeeze a year's worth of work into 16 weeks, and our schedules are full from day to night. And
it's hard.
Adding something onto that
is hard.
becomes problematic.
We did an implicit bias training that actually came out of a meeting down here with a group of people on that horrible snowstormy day. Do you remember that when we met? And people suggested that was one of the things that we should be doing. And there were, I don't know, there were maybe
It's something you and Senator Ballant did, right?
Yeah. Well, no, we set it up. We did. It was done by another member of the House who actually conducted the training, because that's what she does. So that was good that we didn't have to pay for trainers to come in. But yeah, and that was on implicit bias, and there were maybe 50 people there, staff and legislators. So that was good, and I think the same thing will happen with the ethics.
And we can put the link up on the screen here afterwards, but if anybody at home wants to get a sense of their own implicit bias, there are various websites where you can take a quick quiz. And it is enlightening to see that perhaps we all have something we can learn in that regard.
Yeah,
One of them, I
it
think, is at Harvard.
Yeah.
And I think that's the one that I took, and it just takes a few minutes, but it highlights what we also found out at the We Can gathering back in March when we had the panel of people of color here. And there was the reminder that for people of color living in this area here, that once in a while there's some nice things that happen, and that in their everyday lives, though, that many of them experience bias from the white majority here that doesn't feel very good.
Right.
And as much as we want to pat ourselves on the back as being a liberal, progressive, open-minded area, there's still a lot of work for all of us to do in terms of being more welcoming and accepting of all people who live here.
Can I just add one more thing about the ethics that doesn't have anything to do with bias? But one of the provisions of the Ethics Commission is that I could call and say, give me your opinion. I don't know if this is an ethical violation or not. I don't know. So help me understand whether it is. And I think that's really valuable, because right now there's no place for people to go if they have a concern that would be kept confidential. So this is a confidential inquiry you can make. And I just will say that there are lots of places that put out report cards on the states, and I think that it's wise for all of us to pay no attention to those report cards, because Vermont gets an F on every one of them. And
partly because we're a part-time legislature.
Well, it isn't. It's the questions that they ask are things like, I mean, this is across the board. This is judiciary, everybody. And one of the questions, for example, if you go deep into the questions, is do you have a policy for your legislators, staff, on nepotism? Do you have a nepotism policy? Well, no, we don't have a policy because we don't have any staff. So we don't have a policy. And I've called the Center
for... And we get a bad mark on it.
We get an F because of that. So I've called them and tried to say, you should change your questions if you really want to know but they aren't interested.
Well,
so
to pop that balloon, the reality is we don't have staff, we don't have offices, so it goes back to that when people try and get a hold of us and we don't respond the same day, it's usually because we have to do all that ourselves, and it takes a while to wade through our lists.
Yeah, I'm still answering some from April.
Yeah.
So I don't know if you want to switch here a little bit, but one of the things that Judiciary did, government operations also did a lot of elections cleanup and responded to the recount issue, and that the heavy work for that bill came out of the House. Because you were the ones that had to deal with that recount issue. But so we did end up passing that. But one of the things that Judiciary looked at was how our prisoners with mental health issues are dealt with, and what kind of services and assistance do they get when they're in prison and they have a mental health crisis. And I think it's a very complicated issue, and we don't have enough. Our community mental health system is so underfunded that, and this is kind of a parallel system in the prisons. So we did try to deal with that and made some suggestions, and I believe that there's going to be a new definition for segregation. Mm-hmm. But when somebody's having a mental health crisis, they need to be separated. Segregation isn't the right word, but they need to be separated from either the prison general population or the outside general population. And so we've tried to work on that. I don't know if we talk a lot about the huge number of people that are incarcerated. And it is true. But 10 years ago, or 8 years ago when I first got on the Judiciary Committee, Vermont had the highest rate of incarcerated people per population than any other state. We now have the lowest. I don't know if you knew that or not, but we have the absolute lowest rate of incarcerated people.
And there's a lot of reasons for that. And I think we've been looking at how violent offenders are, unless you're a violent offender, then we're going to take a different look at whether you should be incarcerated or not. And our own Sheriff Clark right here has, I think, a really progressive, forward-looking way of increasing his electronic monitored status of.
Unfortunately, I think that's going to end up going to the Department of Corrections.
But it's a good idea.
It's a great idea, and he did
keeps people out of jail who might not deserve to be there, but still need to be monitored.
Yeah, and it isn't just nonviolent.
Yeah.
There are some people who might be violent offenders, who domestic abusers would be considered a violent offense, but there is some evidence that with certain people, the electronic monitoring works really well for them, even though they are violent.
You mentioned mental health crisis for people in prison. That's an easy segue into mental health crisis for people in the general population and the challenges that our mental health system continues to face. To serve that population, we still have a problem with people in crisis being in emergency rooms for hours, sometimes days. We started to address that. Can you share a little bit about?
Well, I think that we think of it as being a lack of beds for crisis people, and I think that's the wrong approach. So the way the Senate looked at it this year, and a lot of it was due to Senator Ayer, because she's the chair of Health and Welfare, and we spent a lot of time looking at what actually is available out there. And if you think of it as a pyramid, so you have people in crisis who need acute level care, much as you do somebody who goes to the emergency room at the hospital and needs to be in the ICU. So you have acute level care, and then you have kind of a step down. So you have residential secure, and then you have staff secure places, and then you have community services. And the real problem with getting people into the acute is not that there aren't enough beds, but that there aren't the appropriate step-down facilities, so people are kept there for too long.
It doesn't open up beds then subsequently.
Right. So the thought was that what we need to do is we need to beef up our community mental health system. And if you look at the designated agencies here in Windham County, it's HCRS. There are 400 vacancies across the state in the designated agencies. That's outrageous. That means there are 400 people not dealing with people in the community who are having mental health issues.
There's a similar situation happening in early education and childcare now, where the pay is so low you could go to McDonald's and make more money, but the responsibilities, and this is why we tried to give a raise to those people working in mental health now. Right.
Well, and it's in the budget. There's, I think, $3.5 million in the budget. It isn't new money, but it's so to hopefully keep more people in the mental health system at the community level, which then will be able. And it's more humane anyway. That people shouldn't have to wait until they have a crisis and need that acute level of care in order to get care.
And we should add that the designated agencies have quite a spectrum of services. That they deal with people with severe mental health illness. They deal with addiction treatment. They deal with developmentally disabled people. And then there's the lower level mental health services beyond the severe and persistent mental health that they are asked to deliver services for. So we ask a lot of them, and they've been stretched to the max with their capacity and trying to find good workers for what they can pay.
Right, and part of the problem is that this is a service that is a part of a government service. It's but we took the tack years and years and years ago, and I'm not sure why, but we took the tack of not providing it by the state, but instead contracting with designated agencies. So they have the responsibility of carrying out a government function, which is to help people who are in mental health or developmental disabled situations, but we don't give them the benefits that if it was all provided by state employees, it would be very different because they would be getting paid better, there wouldn't be the turnover. I don't know why we made that decision to begin with.
Well, I think, as I remember it, this was before my time.
Oh, it was
but
long
the history
before
is,
my time.
Senator Leddy at the time headed an effort to bring together all of the different agencies, and they were here, and they weren't working together, they weren't working in concert, and the idea was that we needed to create a uniform system, and that's where the designated system came in. At the time, the demands on them weren't as great, and maybe we need to take another look at them and see if maybe developmental services should be here, mental health services here. We ask a lot of them.
We do.
And perhaps this I think was either in the 60s or 70s that this happened.
Well, it also, and that was coordinating them, but why it wasn't viewed as a state function. Plowing the roads is a state function, and we pay for it with state employees. It's part of the state government.
I think it's part of the evolution of how we perceive mental health as well.
Yeah,
and
probably.
We're still working. On the books is the law that says we shouldn't discriminate. There should be parity between mental health patients and physical health patients, but in reality, we're still not there.
Yeah, and probably won't be for a long time to really have true parity. But I think that we did. We've started that. I think that the hopefully the budget will pass. Yeah. We'll have a budget, and there are. I know we don't want to talk too much about that, but there are really important things like that in the budget. Sure. Very important things.
There's a huge housing piece.
Huge housing piece.
We recognize housing, the need for workforce, affordable housing is there. There's quite a bit of money for there. We've only got 2 minutes left, though.
Okay.
One of the other bills you've been working hard on for years is to pass a comprehensive marijuana bill.
Yes, I have been.
We passed something, got it through both House and Senate. Another veto. Yep. Do you think we're going to find a settlement for that?
I don't know. I'm a little bit frustrated because some of the recommendations that came from the governor afterwards, some of them actually were in the bill, but they were good sound bites, and some of them would have been easy fixes if they had come forward during when the budget or the bill was being.
I think that's a good point, whether it's the budget or this bill, that the governor waited until the last minute, and it sure seems like he was playing politics rather than focusing on policy. Yeah,
because many of those fixes could have been in either, well, there's 3 vetoes.
Yeah.
And many of those fixes could have been in any one of those bills if it had come forward earlier. But not only did it not come forward, even when it started, even when there were the issues, there were no concrete suggestions from the governor's office. Yeah. There was nothing in writing. There was no, and I know that you're going to talk with Becca, and she's been more involved in that, in the kind of process. I'm sure she can talk about that a little bit.
Yeah. Eventually, we will have the pot bill. Catch up with our neighbors.
Maybe. I mean, we'll see. I think that the 2 issues that are of most concern are driving impairment, and we know that we arrested people for DUI before there were breathalyzers, so we can do it with impaired drivers and kids. And I think that regulating is a better way of keeping it away from kids than having it all on the black market.
Prohibition has not worked.
It has not worked. And kids will tell us that it's really easy to get pot. Really easy. Bathrooms of the schools.
Well, we're about out of time, but I want to thank you for taking the time. Thank you for your work this year in the legislature. And
thanks. Well,
we're starting to get ready for the next session already. So if people want to get in touch with you, how would they do that?
Well, my home phone number is 387-4379. It's in the phone book under Bill and Jeanette White. And
email?
Legislative email. And I try to keep on top of it, but it is, as you said, it's hard because we have to do it ourselves. And then we have our full-time jobs.
We have our full-time paying jobs, too.
Yeah.
So, but thank you for your work, and thank you again to the people here at BCTV for their work in helping
Yes.
share what we do.
Yes.
They do a great job in helping bring the work in Montpelier closer to you here. So thanks a lot to them, and thanks for tuning in. Till next time, bye-bye.
Bye.